There will be another research presentation by Shaluni Tissera. The topic is Attitude Towards Health Information, Privacy and Electronic Health Records among Urban Sri Lankan Adults. In the morning we had a session on privacy and security of the EMRs. Shaluni is a third year nursing student, and then she's the president of Scientific Committee of International Institute of Health Sciences, and also she has published over 6 international publications, and also she's the current representative of Sri Lanka for the Nursing Informatics Society, global society. Shaluni Tissera.
I'm Shaluni. I did a study on attitude towards health information privacy and electronic health records among urban Sri Lankan adults. I'll quickly go through the contents. Introduction, I'll have an objectives and the methodology, results, discussion, and I also have recommendations. Electronic health records contain extremely sensitive information of the patients. So the privacy and the security of these health records are very important, because any exposure of these private information can lead to great catastrophes. For an example, I would like to bring out a story which was published in social media on the President Lanka Plus NGO, who openly goes in public and say, when her husband was diagnosed with HIV and the results were leaked out by the hospital employees, all the hardships that she went through and which got her husband forced to commit suicide. Leaking out of health information leading to great catastrophes is not only happen in Sri Lanka but all over the world. Understanding that, on 21st of August 1996, the President of United States, Bill Clinton, has signed the Health Insurance Portability and Accountability Act. In that act, it has emphasized on the provisions to ensure the privacy and confidentiality of identifiable health information. For an example, this act has several dimensions, and 2 key areas that I would like to emphasize here, which I took for my research, were the rule of privacy and the rule of security. So moving on with the presentation, I would tell you what an electronic health record is, since it is very new to our country. Electronic health record is a longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting, from patient's vital signs to laboratory and radiology reports. So by the time I was doing my study, the government of Sri Lanka has drafted the National E-Health Policy of Sri Lanka, and now it has implemented. This policy, the e-health policy of Sri Lanka, also emphasized the need of electronic health records significantly in the policy. So with all those in mind, my research objectives were to describe the perception of the Sri Lankan adults on health data privacy, to describe the routine IT-related security practices among Sri Lankan adults, and to describe the attitudes towards electronic health records among Sri Lankan adults. My research study was a descriptive cross-sectional quantitative study, and there were male and female participants over 18 years in urban and suburban urban areas of Sri Lanka, and there were 227 participants, and I used convenient sampling, and the data was collected using an online questionnaire. So moving on with the results, there were almost equal number of female and male participants, and majority of them were graduates or they have completed the advanced level examination, and most of the participants were less than 25 years. So when I questioned about records, majority of them said themselves, the doctor and the family should have the ownership of their records, and moderate amount of participants said themselves and the doctor need to have the ownership, and quite a few only said that only themselves need to have the ownership of their health records. And when I questioned about the general IT behaviors of them, majority of the participants were very comfortable in using information technology for their daily activities. And when I questioned whether they use password protection for their important information, majority of 178 participants used password protection, but there were quite few participants who shared their password of the important documents among others as well. And also, when I questioned about the perception on their perception on electronic health records, they thought that a majority of the participants thought there could be increase in medical errors when using electronic health records. But majority thought it would prevent data loss from electronic health records. And when I questioned about the security of electronic health records versus the current or the existing health records, again, majority thought they were equally secure to the current or the existing health records, so more secure than the existing ones. So when I questioned about their attitudes on electronic health record systems, they thought electronic health records would definitely or moderately, at least a bit, would be disclosed. The sensitive information would be disclosed when they are using electronic health records. But when I asked if there was a national electronic health record system in Sri Lanka, how do they want to have their health information stored? 64% said they needed a complete record to be in the health information system, and 32% needed a partial record to be stored in the system. And when I questioned about the perception on health information exchange, they thought it's a majority of the participants thought it's a very confidential communication method to exchange their health information. And also majority thought the health information exchange would improve the quality of care delivery. But when I asked about the concerns on unauthorized access, 45% of the respondents were somewhat concerned, and quite high number of participants were very concerned about unauthorized access to their health records. So then I analyzed the general IT behaviors versus their security concerns. So the people who said that they are very concerned about unauthorized access were the people who did not use password protection on their documents. And the people who were not very concerned about unauthorized access were the people who used password protection to their own documents. And when I analyzed about the trust on health institutions, the participants had, and I asked them to rate their trust levels on a scale of 1 to 10. A majority of the participants had their level of trust less than 5. So when I asked about the loss of data from their concerns on loss of data from electronic health records, the majority of the respondents who said there would be a loss of data from electronic health records were the participants who had less trust on the health institution. Also, the participants who said that they are very concerned on unauthorized access for their health records were the ones, the majority of those were the ones who rated their trust levels on health institutions less than 5. So moving on to my discussion, my research review, many did not have a clear idea about the health data ownership. Majority of the participants were concerned about data security and privacy. Majority believed that electronic health records would increase medical errors. Many were comfortable with the concept of future electronic health record system. The problem here, ladies and gentlemen, is the people have, yes, they have privacy issues, they have security issues, but they would like to have an electronic health record system in the country. But the major issue that I found out from my research is they do not trust the health institution. So, the research studies have shown that people's concerns or negative attitudes can be positively influenced in strengthening the system. So, I would like to recommend to improve the reliability of the health institutions, to bring out new policies and stronger laws and legislation, because that is where the problem is. People do not trust the institution. And also to improve the infrastructure of electronic health records, like to train personnel, to have more buildings, stable power supply, networks and internet and other facilities, and also to improve public education and awareness of electronic health records before having and before setting up an electronic health record system in our country. I would like to acknowledge International Institute of Health Sciences and Dr. Kitsiri and Dr. Nishanto for helping me out with this research. These were my references. Thank you.